Have you ever wondered how a disease can grow silently inside the body for months or even years without giving any obvious warning? Imagine waking up every morning feeling mostly normal, going to work, spending time with your family, and believing everything is fine, while deep inside your body, something dangerous is slowly developing. That is exactly what makes pancreatic cancer one of the most challenging cancers in the world. Unlike many other illnesses that announce themselves with pain or noticeable symptoms, pancreatic cancer often begins quietly. By the time many people realize something is wrong, the disease may already have reached an advanced stage. That's why doctors often call it a silent disease. But here's the encouraging news. Our bodies are incredibly intelligent. Even when a disease tries to hide, the body often sends small signals. The problem is that these signals can seem so ordinary that they're easy to ignore or blame on stress, aging, poor sleep, or a busy lifestyle. In today's video, we're going to explore 9 important symptoms that may appear before pancreatic cancer is diagnosed. It's important to remember that having one or even several of these symptoms does not automatically mean you have cancer. Many common conditions can cause the same signs. However, if these symptoms persist, become worse, or appear together, they deserve medical attention. Early evaluation can make a significant difference. Before we begin, if you enjoy learning practical health information that could help protect you and your loved ones, consider subscribing and turning on notifications so you never miss our future videos. Now let's start with the very first warning sign. Symptom number 1. Persistent pain in the upper abdomen or back. Many people expect cancer to cause severe pain immediately. Pancreatic cancer usually doesn't work that way. Instead, the discomfort often starts gradually. It may feel like a dull ache in the upper abdomen, somewhere just below the ribs. Sometimes the pain spreads around to the middle of the back. Rather than being sharp, it often feels deep and difficult to pinpoint. People sometimes describe it as a pressure or heaviness, rather than actual pain. Why does this happen? The pancreas sits deep inside the abdomen, close to the spine, and surrounded by important nerves. As a tumor grows, it can begin pressing on these nearby nerves and tissues, creating discomfort that radiates into the back. One interesting clue is that the pain may become worse after eating, especially after large or fatty meals. Some people also notice it becomes more uncomfortable when lying flat, while leaning forward provides temporary relief. Because back pain is extremely common, many people assume they've simply slept in an awkward position or strained a muscle. Others blame poor posture from sitting at a desk all day. And that's exactly why this symptom is often overlooked. Occasional back pain is normal and usually harmless. But if you experience persistent upper abdominal pain that spreads into the back without an obvious cause, and especially if it continues for weeks, it shouldn't be ignored. Now let's move to another symptom that many people dismiss as nothing more than dieting or stress. Symptom number 2. Unexplained weight loss. Most people are happy when they lose a few pounds without trying, but unexplained weight loss can sometimes be your body's way of saying something isn't right. If you've made no changes to your diet or exercise routine but continue losing weight, it's important to understand why. Pancreatic cancer can interfere with digestion because the pancreas produces enzymes that help break down food. When these enzymes aren't working properly, your body may struggle to absorb nutrients efficiently. Even if you're eating normally, you may begin losing weight. In addition, cancer itself changes how the body uses energy. Tumors can increase the body's metabolic demands while reducing appetite at the same time. This combination often leads to steady, unexplained weight loss. Some people notice their clothes becoming loose. Others realize their face appears thinner in photographs. Family members may comment that they look different. Because modern society often celebrates weight loss, people sometimes see this as a positive change rather than a possible warning sign. But unintended weight loss, especially more than 5 to 10% of your body weight over several months, should always be discussed with a healthcare professional. The sooner the cause is identified, the sooner appropriate treatment can begin if needed. And surprisingly, the next symptom doesn't involve pain or weight at all. Instead, it can appear in one of the most unexpected places: your skin. We'll explore that surprising warning sign in the next part, along with several other symptoms that many people never realize could be connected to pancreatic cancer. Welcome back. In the first part of this video, we talked about 2 warning signs that many people ignore: persistent upper abdominal or back pain and unexplained weight loss. These symptoms don't automatically mean pancreatic cancer, but when they continue without a clear explanation, They deserve medical attention. Now let's continue with the next warning signs. Some of them are so subtle that people often mistake them for minor health problems. Yet in some cases, they may be the body's early attempt to signal that something serious is happening. Let's begin with symptom number 3. Symptom number 3, yellowing of the skin and eyes, jaundice. Imagine looking in the mirror one morning and noticing that the whites of your eyes don't look white anymore. Instead, they have a yellow tint. A few days later, your family starts asking if you're feeling okay because your skin also looks slightly yellow. This condition is called jaundice, and it is one of the most recognizable warning signs associated with pancreatic cancer. But why does it happen? The pancreas is located very close to the bile duct, a small tube that carries bile from the liver to the intestines. Bile helps digest fats and also carries away bilirubin, a yellow-colored waste product. If a tumor grows near the head of the pancreas, it can press against or block the bile duct. When this happens, bilirubin can't leave the body normally. Instead, it builds up in the bloodstream, causing the skin and eyes to turn yellow. Sometimes jaundice appears before any pain develops. That's why doctors take this symptom very seriously. Along with yellow skin or eyes, people may also notice dark-colored urine, pale or clay-colored stools, and intense itching. Even if you feel otherwise healthy, these symptoms should never be ignored. Jaundice does not always mean pancreatic cancer. It can also result from liver disease, gallstones, or infections. However, it always requires prompt medical evaluation because something is interfering with the normal flow of bile. Now let's move to another symptom that often seems unrelated. Symptom number 4, digestive problems that don't go away. Everyone experiences stomach problems occasionally. Maybe it's something you ate. Maybe it's stress. Usually, these issues disappear within a day or two. But pancreatic cancer can cause digestive problems that continue for weeks. Since the pancreas produces digestive enzymes, any disruption in its function can make it difficult for the body to process food properly. People may notice frequent bloating after meals. Some feel full after eating only a small amount. Others develop nausea that keeps returning without any obvious cause. Indigestion may become a daily problem, even when eating foods that never caused trouble before. Some individuals also experience vomiting, especially if the growing tumor begins affecting nearby parts of the digestive system. Because these symptoms are so common, many people assume they simply have acid reflux, gastritis, or food intolerance. They buy over-the-counter medications, change their diet, or wait for things to improve. Sometimes they do improve temporarily, but if digestive discomfort continues for several weeks despite lifestyle changes, it's important to seek medical advice. Persistent digestive symptoms always deserve an explanation. Now here's a symptom that many people find embarrassing to talk about. Yet, it can provide an important clue. Symptom number 5, changes in stool. Most of us don't pay much attention to our bowel movements, but they can reveal a surprising amount about what's happening inside the body. When the pancreas isn't producing enough digestive enzymes, fat isn't broken down properly. As a result, stools may become pale, greasy, oily, or unusually foul-smelling. They may float instead of sinking because of their high-fat content. Some people also notice that flushing the toilet doesn't remove everything easily because the stool sticks to the bowl. Doctors call this condition steatorrhea, which simply means excess fat in the stool. This isn't something that happens after just one unusual meal. Instead, it tends to occur repeatedly. The body is essentially saying that it's having trouble digesting fats. Over time, this poor digestion can contribute to weight loss, vitamin deficiencies, fatigue, and weakness. Again, pancreatic cancer is only one possible cause. Chronic pancreatitis, celiac disease, gallbladder problems, and several digestive disorders can produce similar symptoms. The important message is not to ignore persistent changes in your bowel habits, especially when they appear alongside unexplained weight loss or abdominal pain. Our bodies often communicate through small changes long before major illness develops. The challenge is learning to recognize those signals. So far, we've covered 5 possible warning signs: persistent abdominal or back pain, unexplained weight loss, yellowing of the skin or eyes, ongoing digestive problems, greasy or unusual stools. Remember, having one of these symptoms doesn't mean you have pancreatic cancer, But when several appear together or when they refuse to go away, they deserve medical evaluation rather than self-diagnosis. Unfortunately, the next symptoms are even easier to dismiss. Many people blame them on stress, aging, or working too hard. Yet in some cases, they may point toward a problem developing deep inside the pancreas. In the next part, we'll discuss symptoms 6 and 7, including one warning sign that surprises many people because it often appears months before pancreatic cancer is diagnosed. You won't want to miss it. Welcome back. So far, we've discussed 5 warning signs that can sometimes appear before pancreatic cancer is diagnosed. These include persistent abdominal or back pain, unexplained weight loss, jaundice, ongoing digestive problems, and unusual changes in stool. As you've probably noticed, none of these symptoms are unique to pancreatic cancer. That's exactly what makes this disease so difficult to detect. The signs often resemble common digestive problems, making it easy to dismiss them as something temporary. Now, let's continue with symptom number 6. And this one surprises many people because it has nothing to do with pain or digestion. Symptom number 6. New-onset diabetes or sudden changes in blood sugar. Imagine visiting your doctor for a routine checkup. You feel mostly fine, but your blood test shows high blood sugar. The doctor tells you that you've developed diabetes. For many people, diabetes develops because of genetics, excess body weight, or lifestyle factors. But in some cases, especially in adults over the age of 50, a sudden diagnosis of diabetes with no clear reason can sometimes be an early clue that something is affecting the pancreas. Why? Because the pancreas doesn't just produce digestive enzymes. It also makes insulin, the hormone that helps regulate blood sugar. If a tumor interferes with the pancreas, insulin production may decrease. As a result, blood sugar levels begin to rise. Sometimes, people who already have diabetes notice that their blood sugar suddenly becomes much harder to control, even though their diet, medication, and daily routine haven't changed. Others experience symptoms such as increased thirst, frequent urination, blurred vision, constant hunger, or unusual tiredness. Of course, the vast majority of diabetes cases are not caused by pancreatic cancer. But when diabetes appears suddenly, especially alongside unexplained weight loss or other warning signs we've discussed, doctors may consider whether the pancreas should be evaluated further. It's another reminder that the body often gives clues long before a serious illness is discovered. Symptom number 7, extreme fatigue. That doesn't improve. Everyone feels tired sometimes. A busy work schedule, lack of sleep, stress. All of these can leave us feeling exhausted. But the fatigue associated with serious illnesses is often very different. People describe it as a deep, overwhelming exhaustion that doesn't improve after sleeping or taking a day off. You wake up feeling tired. Simple daily tasks become difficult. Climbing stairs feels harder than usual. Activities you once enjoyed suddenly seem like too much effort. Some people notice they no longer have the energy to socialize, exercise, or even complete routine household chores. Why does this happen? Cancer places enormous demands on the body. It changes the way the body uses energy, increases inflammation, and may interfere with proper nutrition. If digestion is affected, the body may also struggle to absorb essential nutrients needed for energy production. The result is persistent fatigue that continues day after day. Because tiredness is so common in modern life, many people assume they're simply overworked. They promise themselves they'll rest more next weekend. Then another week passes, then another month. If unusual fatigue continues without an obvious explanation, especially when combined with weight loss, digestive changes, or abdominal discomfort, it's important not to ignore it. Your body could be asking for medical attention. At this point, we've covered 7 possible warning signs. Let's quickly review them. Persistent pain in the upper abdomen or back, unexplained weight loss, yellowing of the skin and eyes, ongoing digestive problems, greasy or pale stools, new-onset diabetes or sudden blood sugar changes, persistent, unexplained fatigue. Remember, these symptoms are not proof of pancreatic cancer. Many common medical conditions can cause them. However, when several symptoms occur together or continue for weeks, they deserve proper evaluation. Now, here's something many people don't realize. Sometimes pancreatic cancer doesn't just affect the pancreas. It can influence the body's entire circulation. That brings us to another surprising warning sign. Some patients develop blood clots before they're ever diagnosed with cancer. A clot may appear in the leg, causing swelling, warmth, redness, or pain. In other cases, a clot may travel to the lungs, leading to sudden chest pain or shortness of breath, a medical emergency that requires immediate treatment. Doctors have known for years that certain cancers can make the blood more likely to clot. Although blood clots have many possible causes, an unexplained clot, particularly when accompanied by other symptoms we've discussed, may lead doctors to investigate further. This is one reason healthcare professionals always look at the whole picture, rather than focusing on just one symptom. Every clue matters. Every detail helps. As we approach the final part of this video, we're going to discuss the last two warning signs, including one that many people completely overlook because it seems like nothing more than itchy skin. We'll also talk about who is at higher risk, when you should see a doctor, and why recognizing these warning signs early can make such an important difference. Those final insights could be the most valuable part of this entire video. Welcome back. So far, we've explored 7 possible warning signs that may appear before pancreatic cancer is diagnosed. By now, one thing has probably become very clear. This disease rarely announces itself with one dramatic symptom. Instead, it often reveals itself through small changes that slowly become impossible to ignore. That's why paying attention to your body matters. Today we'll discuss the final 2 symptoms on our list. These signs are often overlooked because they seem harmless or are easily blamed on other conditions. Let's begin with symptom number 8. Symptom number 8. Persistent, itchy skin. Have you ever experienced itching that just wouldn't go away? Maybe you changed your soap, applied moisturizer, tried allergy medication, but nothing seemed to help. Most people assume itchy skin is caused by dry weather, allergies, or a skin condition like eczema, and in many cases, that's exactly the reason. But persistent itching can sometimes be a hidden sign of a problem occurring much deeper inside the body. Here's why. As we discussed earlier, pancreatic cancer, especially when it develops near the head of the pancreas, can block the bile duct. When bile cannot flow normally, a substance called bilirubin begins to build up in the bloodstream. This buildup doesn't only cause jaundice. It can also trigger intense itching, sometimes even before the yellow color of the skin becomes obvious. People often describe the itching as deep and widespread. It may affect the arms, legs, chest, back, or even the palms of the hands and soles of the feet. Unlike a typical rash, there may be no visible skin irritation at first. Some people scratch so much that they create marks or even small wounds on their skin. Because the itching seems unrelated to the pancreas, many spend weeks or even months treating it as an allergy. If persistent itching is accompanied by yellowing of the eyes, dark urine, pale stools, or abdominal discomfort, it's important to seek medical evaluation rather than continuing to treat only the skin. Sometimes the skin is simply reflecting what's happening inside the body. Symptom number 9. Loss of appetite and feeling full quickly. Everyone skips a meal occasionally. Stress, hot weather, a busy schedule. These can all reduce appetite for a short time. But pancreatic cancer may cause a much more noticeable and persistent loss of interest in food. Many patients say they simply don't feel hungry anymore. Even when they sit down to eat, they become full after just a few bites. Meals they once enjoyed suddenly seem unappealing. Some people even develop an aversion to rich or fatty foods. Why does this happen? Several factors may be involved. A growing tumor can interfere with digestion, causing discomfort after eating. Inflammation caused by cancer can also affect the body's appetite-regulating hormones. In addition, nausea and poor digestion may make eating feel unpleasant. Over time, eating less leads to weight loss, weakness, and reduced energy. Because appetite naturally changes as people get older or during stressful periods, this symptom is often dismissed. But when appetite continues to decline without an obvious reason, and especially when it occurs alongside other symptoms, it deserves medical attention. Your body needs fuel. When it suddenly stops asking for it, there's often a reason. Looking at the bigger picture. Now we've covered all 9 possible warning signs. 1. Persistent pain in the upper abdomen or back. 2. Unexplained weight loss. 3. Yellowing of the skin and eyes. Jaundice. 4. Ongoing digestive problems. 5. Greasy, pale, or floating stools. 6. New-onset diabetes or sudden blood sugar changes. 7. Extreme persistent fatigue. 8. Persistent itchy skin. 9. Loss of appetite or feeling full very quickly. Here's something extremely important to remember. Almost every one of these symptoms can be caused by conditions that are much more common than pancreatic cancer. Gallstones. stomach ulcers, liver disease, acid reflux, food intolerances, diabetes. Even stress can produce symptoms that overlap with this list. That is why one symptom alone is rarely enough to suggest pancreatic cancer. Doctors look for patterns. They consider your age, medical history, family history, physical examination, blood tests, and imaging studies before reaching any diagnosis. The key message isn't to panic. The key message is not to ignore persistent changes in your health. If your body keeps telling you something is different, it's worth listening. Who may be at higher risk? Although pancreatic cancer can affect anyone, certain factors increase the risk. These include being over the age of 50, smoking tobacco, obesity, long-term diabetes, chronic pancreatitis, a strong family history of pancreatic cancer, certain inherited genetic conditions. Having one or even several of these risk factors does not mean someone will develop pancreatic cancer. Likewise, people with no known risk factors can still develop the disease. That's why awareness of symptoms remains important for everyone. In the final part of this video, we'll discuss when you should see a doctor, how pancreatic cancer is diagnosed, what tests doctors may recommend, and why early detection can dramatically improve treatment options. We'll finish with one powerful message that could encourage viewers to take their health seriously, not with fear, but with knowledge and timely action. If you've stayed with us until now, you've learned about 9 warning signs that may sometimes appear before pancreatic cancer is diagnosed. Hopefully, one message has become clear. Pancreatic cancer is often called a silent disease because its symptoms usually develop slowly and can easily be mistaken for everyday health problems. But silence doesn't always mean there are no clues. Sometimes the clues are simply subtle. The difference between ignoring those clues and acting on them can have a significant impact on a person's health. So, the question becomes, when should you see a doctor? The answer is actually quite simple. If you notice a symptom that doesn't go away, keeps getting worse, or appears together with several of the warning signs we've discussed, it's time to schedule a medical evaluation. For example, imagine someone who develops ongoing upper abdominal pain, starts losing weight without trying, and suddenly notices yellowing of the eyes. Or someone who experiences persistent digestive problems, greasy stools, and extreme fatigue for several weeks. None of these symptoms automatically mean pancreatic cancer, but together, they tell your healthcare provider that your body needs a closer look. Far too many people delay seeing a doctor because they hope the symptoms will disappear on their own. Others are simply too busy. Some worry about what they might hear, and many convince themselves that it's probably nothing serious. While it's true that most persistent symptoms turn out to have causes other than cancer, getting checked early is always better than waiting until the problem becomes more advanced. How do doctors diagnose pancreatic cancer? If your doctor suspects that something may be affecting your pancreas, they won't rely on symptoms alone. Instead, they'll begin gathering information step by step. First comes a detailed conversation about your symptoms. When did they start? Have they changed over time? Have you lost weight? Do you have a family history of pancreatic disease? Do you smoke? Have you recently developed diabetes? These questions help doctors understand the overall picture. Next comes a physical examination. If jaundice is present, your doctor may notice yellowing of the eyes or skin. They may gently examine your abdomen for tenderness or swelling. Blood tests are often the next step. These tests can check liver function, bilirubin levels, blood sugar, and other markers that may suggest a problem involving the pancreas or bile ducts. If additional evaluation is needed, imaging tests may be recommended. These can include CT scans, MRI scans, ultrasound, or an endoscopic ultrasound, which allows doctors to obtain detailed images of the pancreas. In some situations, a small tissue sample called a biopsy may be needed to confirm the diagnosis. Every patient's situation is different. That's why doctors choose tests based on each individual's symptoms and medical history. Why early detection matters. One of the biggest challenges with pancreatic cancer is that it is often diagnosed after it has already spread. When cancer is found early, before it has grown extensively or spread to other parts of the body, more treatment options may be available. Depending on the stage of the disease, treatment may include surgery, chemotherapy, radiation therapy, targeted therapy, or a combination of these approaches. Medical science continues to make progress. New treatments are being developed. Earlier diagnosis is improving outcomes for many patients. This is why awareness is so important. Not because awareness creates fear, but because awareness creates opportunity. Opportunity to ask questions, opportunity to seek medical advice, opportunity to receive treatment sooner if something serious is found. What you can do to protect your health. While no one can completely prevent pancreatic cancer, there are healthy choices that may help reduce the risk. Avoid smoking if possible. Maintain a healthy body weight. Stay physically active. Eat a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Manage diabetes carefully if you have it. Limit excessive alcohol consumption, which can contribute to chronic pancreatitis. Attend regular medical checkups, especially if you have a family history of pancreatic disease or other risk factors. Most importantly, pay attention to your body. You know your body better than anyone else. If something feels different for weeks or months, don't ignore it simply because you're busy or because the symptoms seem small. Small changes sometimes tell the biggest stories. A final thought. Before we end today's video, remember this one important message. These 9 symptoms are not a checklist for diagnosing pancreatic cancer. Many people experience one or more of them because of conditions that are far more common and far less serious. The goal of this video is not to create fear. The goal is to encourage awareness. Knowledge helps people make informed decisions. It encourages conversations with healthcare professionals. And sometimes, it leads to earlier diagnosis, not only of pancreatic cancer, but of many other medical conditions as well. If today's information helped you learn something new, take a moment to share this video with your family and friends. You never know who might benefit from recognizing these warning signs. And if you enjoyed this video, don't forget to like, subscribe, and turn on notifications so you never miss our future health education videos. Thank you so much for watching. Stay informed, stay healthy, and we'll see you in the next video.